Good morning, everyone. Let's get started. Welcome to Grand Rounds. My name is Aditya Lati. I'm one of the Grand Rounds directors, along with Dr. Rebecca Mueller and Alex Harris. But today it's just me. Next week, we're going to be having the Essex Lecture Endowment Series Grand Rounds. The speaker is Dr. Rinad Baidas, professor and chair of the Department of Social Medical Sciences at Northwestern University. Her talk is titled Leveraging the Power of Implementation Science to Transform Mental Health Care. This talk will be in person, so we look forward to seeing you in the Hellman Auditorium. I have a couple of quick departmental announcements before we proceed to today's talk. The next town hall for PIs is going to be on Tuesday, April 30th at 10 o'clock. As a reminder, to view the schedule for upcoming Grand Rounds, please visit the HRPP section on Insight or contact Iris Delgado. These town halls are open to PIs as well as their research teams. We also wanted to invite you to remind yourself of the NISP Governance Board meetings. There are three actually meetings this week, 2 on Thursday and 1 on Friday in the NISP auditorium. Participation in one of these meetings is required if you're doing human subject research. Before we turn to today's speaker, I just wanted to remind everyone that they could ask questions at any time during the talk. Please use the Q&A feature of the Zoom, not the chat feature. If you're a trainee, please write the word trainee, as we like to prioritize trainee questions. Finally, if you would like to ask your question yourself, please let us know as well. Can ask question myself, and then we'll promote you temporarily to panelist, and you could ask your question live. So for today, we have the DeHirsch Robinson Grand Rounds, a special Grand Rounds, and I want to introduce our faculty, Dr. Amy Margolis, who will say a few words about this Grand Round venue, and then introduce today's very exciting speaker for you. So I'd like to invite Amy to begin.
Thank you, Adi, and welcome everybody to the DeHirsch Robinson Lecture Series Grand Rounds. I'm going to tell you a little bit about this series. There's the lecture series that we're hosting today and a fellowship, which are the critical component of our new Learning Disability Innovation Hub here at Columbia. And the DeHirsch Robinson was funded by the Kovner family, who endowed a gift to the hospital in 1989 to extend the reach of pediatric psychiatry services to children in our local community, and specifically for children coping with the challenge of dyslexia or other learning disabilities. And so part of that gift supported a DeHirsch Robinson Reading Clinic for many years, and was named after Katrina DeHirsch, who was a speech therapist who pioneered the field of childhood language and learning, and who was a close colleague of Dr. Jansky, who ran the clinic. And Dr. DeHirsch was instrumental in connecting the fields of reading disorders and language disorders, and emphasized the importance of educating both children and their parents on the needs of students with learning disabilities. And to commemorate her legacy of scholarship and research in dyslexia and other learning disorders, the then director of child and adolescent psychiatry used the Kovner family gift to establish this DeHirsch Grand Rounds to be delivered by a distinguished expert in reading disorders and pediatric mental health. So it is my incredible pleasure to introduce Dr. Sharon Vaughn today. I am just thrilled that she could be with us. She is the Manuel J. Justiz Endowed Chair in Education and Executive Director of the Meadows Center for Preventing Educational Risk at the University of Texas at Austin. She has published over 250 papers, 35 books, and 65 book chapters, including numerous landmark papers that address the reading and social outcomes of students with learning difficulties. She's also gotten funding from all the sources, the Institute for Education Sciences, the National Institute for Child Health and Human Development, and the U.S. Department of Education. She served as the editor-in-chief of the Journal of Learning Disabilities and co-editor of Learning Disabilities Research and Practice. As a testament to her love of teaching and talent at mentorship, she was awarded the University of Texas Distinguished Faculty Award. She is truly a force in the field and also in life. I feel it wouldn't be correct to introduce her without letting you all know that she has run many marathons in her life, including coming in third in the Chicago Marathon this past year, has run the Boston Marathon a few times, London, New York, etc. So in addition to really dedicating herself to helping children learn, she also is incredibly interested in this running. And if you have a chance to ask her questions about marathoning, you will be enlightened. So I hope that in the future, Dr. Vaughn will come visit us in person and help with our ongoing work, thinking about how we help children from underrepresented groups here at Columbia overcome their reading problems, and importantly, consider the psychiatric and psychological problems they simultaneously confront. And thrilled to introduce her and hear her talk today, where she has spent a tremendous amount of her career focused on exactly these questions of how psychological and learning components come together and impact children.
Oh gosh, Amy, thank you so much. It is really an honor and a pleasure to be invited by Dr. Margolis to do this talk. I have been inspired by her work, and it is really an honor to be here with all of you today. I also want to mention that I am aware that the audience includes a lot of expertise, knowledge, and talent. And so as I provide this presentation, not only if you have questions, which I welcome, and I particularly encourage easy ones, but on the other hand, I really want any comments and suggestions and thoughts you have. So I look forward to talking with you today about the title of this talk, which is about integrating reading and anxiety management into an intervention. And Dr. Margolis has talked often about the fact that people in the area of reading often think about how we might include social emotional issues in the way in which we do reading development. But perhaps when we think about anxiety management, we often forget the fact that many children that express anxiety problems and challenges also have reading difficulties. So let's just kind of start with the big question of why we might focus on anxiety. Well, one of the reasons is that we know that anxiety is among the most common childhood disorders. And because anxiety issues, as we know, are more troublesome to the individual than they are to others, they often don't get the attention that more recognized difficulties, such as acting out and significant externalizing problems, get. And we often think of anxiety difficulties as not being at the childhood level, but more being something that occurs after children are more or older, like 12 or 13 or older. But as we know, anxiety difficulties are very common even in young children. We also know that many students, youngsters experience subclinical anxiety. So maybe their anxiety issues are not at such a level to be considered very significant. These elevated levels of anxiety do influence emotional development, and they also influence academic development. So another question we might address is, why would we integrate anxiety management instruction within a reading intervention? And so we often think of academic interventions as being independent of if what we think of as social emotional interventions, and vice versa. We often think of addressing, for example, anxiety or depression or acting out and other externalizing difficulties independently. We think of behavioral interventions or cognitive behavioral interventions. But I think it's really important for us to ask about opportunities throughout the day in which integrating these practices might have a dynamic effect that is greater than the interventions alone. For example, we know that research suggests that there's a bidirectional relation between reading and anxiety, recognizing that as students become less proficient as readers, we are also likely to get increases in anxiety. And in the same way, we know that as students or youngsters begin to express greater and greater levels of anxiety, we are likely to have challenges in the area of reading and also math. And this occurs both as a function of global anxiety and very specifically test anxiety. So, the potential for anxiety to create a sort of cognitive blur so that accessing the kinds of cognitive resources needed to make progress in reading is very high. Thus, this relationship between managing anxiety and productive reading instruction so that students both reduce anxiety and manifest greater response to reading is a target for intervention. So this bidirectional relationship between reading difficulties and elevated anxiety is something that we have worked for over the last 5 years. That is my colleague, Amy Grills and Phil Capon, in order to address both. And as we think about both of these, reading difficulties and elevated anxiety, we think about an intervention that doesn't, if you will, add on anxiety management, but actually integrates it throughout the intervention. So I'll express that more when I start describing the independent variable. But I think it's important to say that students who struggle with reading and do not respond well to reading intervention show higher levels of anxiety initially and over time than those who respond well. So that if we target both in reading intervention and anxiety, the intent is that we will both be able to better manage the anxiety, but also yield increased performance on reading outcomes. So I'm going to start by describing a pilot study that served as the base for the work that we're doing. And this pilot study included 36 students, all of whom were elevated on reading and problems and anxiety problems. It was a quasi-experimental study. And in this study, we integrated a reading plus anxiety management treatment, and we compared it to a reading-only intervention. So in these two treatment conditions, the reading-only intervention was the same in both conditions, but one of them integrated this anxiety management. The experienced research team provided the instruction, and students who received the reading plus anxiety management treatment at the end presented with lower levels of social and general anxiety. However, there were no significant differences on reading anxiety. And reading anxiety is a specific measure in which students self-report on their own levels of anxiety as it relates to particular reading activities. There were also no statistically significant differences on normed reading outcomes, but that would be expected because both conditions received the same reading intervention. So the expectation would be that there would be no significant differences between those two conditions. So that pilot study, small scale, quasi-experimental, but nonetheless promising, encouraged us to do a larger scale pilot study. And so I'm referring to that here as study number 2. In study number 2, we had approximately 128 students in grades 3 through 4, and this was an experimental study. In this experimental study, we randomly assigned students with significant reading problems. And significant reading problems were students whose reading comprehension scores were more than 1 standard deviation behind what would be expected. And these students were then assigned to one of 3 conditions. The first condition was reading plus an anxiety management treatment. So this is an integrated treatment in which reading and anxiety were co-focused on within it. An example of that would be that, for example, when students read passages in the reading plus anxiety condition, the passages would often represent case studies of youngsters who had anxiety difficulties. And so the reading practice was conducted within that case study, and that case study could be used to support ways to help this case manage their anxiety. So students were then taught how to manage anxiety using an approach based on a cognitive behavioral intervention. And this, if you will, anxiety management toolbox designed by Amy Grills was then integrated into the reading intervention. The second condition was a reading plus math computation. And the reason we used reading plus math computation is so that we could block on reading, meaning that the reading intervention in both cases was the same focus, both focusing on word reading, fluency, and comprehension. But in the second treatment, students also, rather than anxiety management, practiced math computation skills. And we think this is a particularly good contrast because anxiety is often associated not just with reading difficulties, but math difficulties. And so we could look at the relative effects of anxiety management integrated into reading with a pretty robust comparison condition. And then the third condition was what we refer to as a business as usual condition or a comparison condition. And we refer to it as a business as usual condition using the language of the Institute for Education Sciences, meaning that the students in that condition received what the school would ordinarily provide them. So in this study, there were three conditions. Students were randomized to the reading plus anxiety management or the reading plus math or the business as usual school provided reading intervention. So in the reading plus anxiety management, we looked at a contrast initially between reading plus anxiety versus the business as usual condition. And students who received the reading plus anxiety management treatment presented with lower levels of social anxiety, as well as general anxiety. There were no significant differences on reading anxiety, although as you can see from Hedges G, it's in the right direction. So negative means the opposite because it's reduction. That's always a little confusing when we're looking at problematic behaviors. The other outcome is that there were no significant differences on norm-referenced reading outcomes, which is often the case and probably expected since both groups received reading intervention. However, the reading plus anxiety management versus the reading plus math computation, again, we would have expected no significant differences on reading outcomes. So let's now look at the findings from a third study in which we had a larger development of screening so that we could better screen students based on reading difficulties, but so that we could also have a larger sample. And I think most of you are probably aware that a lot of this work has been done within the context of COVID, meaning that many of these initial studies, we had to really carefully adjust how we provided treatment and when we provided it because of the unstable nature of schools during that time period. So on to study 3, in which we have now a non-overlapping sample with studies 1 and 2. And we were looking at the effects of an integrated reading plus anxiety management intervention and reading plus math intervention relative to a business as usual on reading outcomes for students with reading difficulties in the upper elementary grades. So again, there are 3 conditions. Students are randomized to each of the 3 conditions. And we block on reading in the reading plus anxiety. We block on reading in the reading plus math, meaning the reading intervention is the same. And then the integration of anxiety or math in those contrasting conditions with what we refer to as a business as usual condition, or again, a school provided reading intervention. And what you can see is that we have a second primary research question, which was examining the effects of reading and anxiety. That's what we refer to as ranks, the integrated reading and anxiety, relative to the reading and math, our math, and the business as usual on anxiety outcomes. So question number 1 deals primarily with reading difficulties and those outcomes. Question number 2 looks primarily at reading outcomes. So to kind of give you a better idea about the sample in this study, students at risk for reading difficulties in grades 3 through 5 were screened at a cohort of elementary schools, yielding a sample of 232 students, all of whom presented with reading difficulties. These students scored below the 30th percentile on the Gates-McGinnity reading test, which is a test of reading comprehension. Then these 232 students were randomly assigned to one of three conditions. And as you can see in the green bubbles, those conditions are the reading and anxiety, reading and math, and business as usual, with between 77 and 78 students in each condition. To get a better idea of the demographics of the students, you can see that about 47% were female, and that the racial composition represented students who were on Hispanic, identified as multiple races, or white, and approximately 50% of the students identified as Hispanic. In terms of the home language was English in 84% of the cases, and 16% of the cases, students reported Spanish as their home language. In terms of students with reading disabilities, meaning they were identified as disabled, and the grade level distribution, you can see that about a third of the students were in third grade, almost half of the students were in fourth grade, and a smaller percentage, 15% of the students, were in fifth grade. So to give you a sense of the timeline for this study, because this is our largest randomized control trial, you can see that in terms of year one, we have pre-test. In terms of year one, we have a post-test, and there's 18 weeks of instruction with about 75 lessons. And so the number of lessons for both reading and anxiety and reading and math were the same. And approximately 10 minutes was provided for the math lessons, which were integrated with the reading lessons. And so the amount of time on reading in both conditions was the same. So the intervention occurred 4 to 5 days per week based on the school, was about 30 minutes a session. There were approximately 75 sessions. The reading and anxiety and the reading and math were provided in small groups of 3 to 5 students. The personnel providing these interventions were all interventionists who were hired, trained, and supervised by the research team. And the interventionists provided both the reading anxiety and reading and math instruction. And the reason we did this is because we wanted to be able to block on interventionist, because we know from previous research that who provides the intervention can predict outcomes. So we wanted to block on the interventionist, assuring that the interventionist provided both our reading and anxiety and reading math. The research team, that would be me and my colleagues, provided the training for these interventionists who we hired and paid. In other words, these were not school personnel, but personnel that were part of our research team. The training was relatively brief. We provided about a 2-day training with 3 2-hour boosters or refreshers. And so we audio taped these sessions, and then we listened to the audio tapes and could provide feedback and boosters to the interventionist to ensure that they were providing the intervention as prescribed. So what are the components of the ranks or the reading and anxiety instruction? So I think it's really important to first focus that approximately 75 to 80% of the time in the lesson was spent specifically on reading. These were students who were identified based on their reading disability, and most of them had trouble with word reading. And in word reading in this age group, the area of difficulty that is most apparent is that these students have difficulty with vowel sounds. They have difficulty hearing and applying vowels, particularly vowel teams. So whether or not it's OU as in bought, or EA as in read or thread, understanding how vowel sounds and vowel teams work was an important part of our reading instruction. In addition, we provided timed decoding practice so that students would become more proficient. Speed of processing, a certain amount of automaticity with word reading is essential in order to get to comprehension. As we know, if students are spending too much time processing at the word level or the sound level, it reduces the amount of cognitive load that they can bring to understanding the text. So this task of time decoding practice with single and multisyllable words was a mechanism for improving automaticity and therefore access to understanding of text. Thirdly, we emphasized word reading and word meaning. So we also know that individuals can read words faster and better if they know the meaning of the word. Furthermore, knowing the meaning of the word is essential to understanding that, thus comprehending text. So the way I conceptualize it is it's word to world. So in other words, if you want understanding, you have to understand how to read the word as well as know its meaning. Additionally, within our instructional components, we used thematic, social studies, and science units. And these units were integrated in a way to focus on information and knowledge building. The rationale for that is that what we know is that students who comprehend text well do so because they are able to read the words automatically, they know the meaning of the words, and they have sufficient background knowledge to bring to bear on the task that they're reading so that they can understand and learn from text. Thus, the importance of background knowledge, and therefore why we in 3rd, 4th, and 5th grade focus not so much on narrative text, but more on hybrid texts like those that are involved in social studies. Additionally, we know that text reading fluency, that is being able to read connected text automatically and at an adequate speed, which at this grade level is going to be at least 75 words correct per minute, is necessary for students to make adequate progress in reading. And lastly, within the thematic social studies units, we focused on what we refer to as stretch text. And if you have not already, I urge you to take a look at the Institute for Education Sciences guidance document on grades 4 to 9 students with reading difficulties. And in this guidance document, they provide clear direction for the components that research has suggested improve reading outcomes for students with reading difficulties in this age span. One of the outcomes they identify is stretch text. What is meant by stretch text is this is text that is above the student's successful reading independent level. So that is, if they can read 90 words correct, if they can read 90% of the words in the text correctly automatically, we might consider that at level for them. Stretch text would be that text that students cannot adequately read correctly 90 words or more. And so these are more difficult texts. You might think of them as challenge texts. And students learn to read and discuss these texts in which we embed vocabulary and comprehension supports in small groups with teachers. The rationale is that a steady diet of text that is at their level does not give students the opportunity to acquire proficiently how to read more challenging texts. And what we know is that the expectation for these students in the classroom is that they are reading on level. And if they are not provided with opportunities to read close to or on level text, when they are providing these texts in the classroom, it is too easy for them to ignore them or not even attempt to read them. So this provides a pathway for them to begin to access more challenging texts. And then the third component of the reading and anxiety instructional components is what we call the Strong Students Toolbox. And in this Strong Students Toolbox, students learn to identify the physical signs of anxiety that they express. And once they understand these physical signs of anxiety, we provide them with practices for what to do under those conditions. They begin to understand the relations between what they think, how they feel, and what they do. And this connectivity gives them a chance to figure out how to pause about what they think and how to address those feelings. In addition, we provide students with clear and specific ways to do cognitive restructuring to help focus them in ways that enable them to manage their anxiety. We additionally provide them with stress or anxiety relaxation techniques so that when they begin to understand their thinking about anxiety, their feelings about anxiety, they have actual practices to relax and support their anxiety management. And this is all done within the instructional component of ranks. So the Strong Students Toolbox, or these techniques, are integrated within the comprehension and reading practices. I contrast that with the reading and math instructional component. Remember, students are randomized to one of three conditions: the ranks condition, which I described previously, the R math condition, or the business as usual condition. Now, what does the R math condition look like? What you will see is that under the column word reading, it's the same as the reading and anxiety. So what we do with word reading in both of those conditions is the same. If you look at the thematic social studies unit, you will see that in terms of comparison between reading and anxiety and reading math, it's all the same. So the reading components themselves are completely the same between reading and anxiety and reading math. The only difference is that within the reading and anxiety condition, students are taught those anxiety management practices that I presented earlier. However, in the reading and math condition, students are provided math computation, in which tutors provide instruction and feedback on grade level math computation skills, and the amount of time matched to the amount of time spent on anxiety management within ranks. This allows us to hold the reading component of the instruction constant, manipulating then the reading and anxiety or math. And then within the Strong Students Toolbox, Amy Grills, the clinical psychologist, has provided several key components. One is that it's grounded in cognitive behavioral theory about thinking, doing, and feeling, and beginning to identify the physical signs of stress. So students learn when they are anxious, what they physically feel like under those conditions, as a way to help them become more cognizant of how they might manage that anxiety. Second, understanding how thoughts influence the symptoms of anxiety and transitioning from these maladaptive to more adaptive thoughts, what we think of as cognitive restructuring. And then, of course, also recognizing behavioral responses to stress, these ways in which we think about stress and respond to stress, and then going and applying the anxiety management practices that we teach students. So, for example, under identifying the signs of stress, the, if you will, the students learn to kind of think about what I can't think. They can't focus. They get dizzy. They get fast breathing. They might get cold hands and feet. They get a racing heart. They might get shaky legs or sore tummy or clenched fist or a lump in the throat or sweaty. So we teach students to recognize whether or not they have one or more of these expressions, and to teach them that the reason we want them to both recognize these symptoms and then apply anxiety management practices to reduce the effect of these symptoms is because these symptoms can sort of take over our thinking. They can take over our cognitive processing in a way that keeps students from focusing. And under those conditions, students can then become less effective in terms of acquiring cognitively advanced skills like reading. So we know that's, and we help students understand that different things bother different people. We're not all affected and stressed and upset about the same thing. So, and students begin to practice reading about these various stressors and applying responses to them. So here would be an example. Students would have a passage like this that would be part of their ranks treatment. Hi, my name is Quentin. I'm in the middle school. I'm a middle school student. Sometimes I get stressed about stuff at home or at school. Like this week, I have to go to the dentist to get a teeth cleaning. I don't like going to the dentist. I'm worried I will have another cavity. I chew on my fingers and duck my head into the hood of my sweatshirt in the waiting room. I try not to focus on things, but then my stomach hurts. I also have a book report due in class this week that I will have to read aloud. I always spend hours awake the night before a book report is due because I worry about having to read the report in front of the whole reading class. I don't like to read in front of a group because I'm not good at reading. The first time I had to read in front of the class in October, my face turned red. My hands were shaking while holding my paper, and I began to sweat. I was worried my classmates were laughing at me because I read more slowly. I try to practice reading aloud in my room, but it's not the same as reading in front of my classmates. While others are reading their reports, I put my head down or ask to go to the bathroom so I can get out of class. I dread book report day. I'm so tired it is hard to study. So this would just be an example of a text passage that would be part of the ranks intervention. And this text passage would have key words that students read, such as stressed, and we would talk about the meanings of them. We would also want students to both read this passage aloud and to themselves. And then we would ask them to provide advice based on the anxiety management practices we taught them, how they would advise Quentin to do a better job in terms of managing stress. And we would ask them to do the strategy about thinking, feeling, and doing in order to look at the relation between thoughts, feelings, and actions and apply what we talk about with cognitive restructuring. So here's another example. Maria was late getting to the lunchroom today. When she walked into the lunchroom, she saw a table with a bunch of her friends sitting at it and started to walk towards them. When she got about halfway to the table, Maria noticed that all of her friends were laughing. She thought to herself, oh no, they're all laughing at me because I had to stay after class. I bet they think I'm stupid. So again, this would be an opportunity in which we would use a case study, practice reading, but we would also ask students to stop and think about how Maria felt and think about what she did next and to think about how she might reframe how she felt and what she thought in a way that would be more successful. So in the students working, we would want students to think about the fact that Maria was thinking she was stupid and everyone was laughing at her. And then she kept thinking about it and worrying about what would happen. So the sort of rumination or overthinking about negative things. We would want them to recognize that. We would want them to recognize that Maria was feeling bad, that her hands were shaking, her stomach was upset, her face was red. This is part of the feeling and, if you will, recognizing physical manifestations of anxiety. And then we would want students to recognize what Maria did. And what she did is she skipped lunch, she didn't talk to her friends, and she didn't focus in her class. So that because she was thinking and feeling bad, she made some decisions that weren't very helpful to her. And what we want students to do, if you will, is then we would ask students to think about cognitive restructuring. Let's help Maria think about what is happening in a different way. What else could have been happening besides the fact that her friends were talking about her? How else might she adjust her feelings so that she did not feel bad? What could Maria have done so that she might address her anxiety? And what could Maria have done to prevent her from skipping lunch and walking away from her friends? So in addition to those kind of case studies and case examples in which we practice the reading and anxiety practices within text, we also teach students how to respond to stress, such as bubble breathing, in which they learn to breathe in through their nose, count to 3, and slowly breathe out through their mouth with the bubbles of 1, 2, 3. So now that you have a pretty good idea about what we do in the reading and anxiety treatment and how the reading is the same in the math treatment, but the difference is we don't provide the anxiety support, instead we provide math support. And then of course, the business as usual condition, which in schools means that the students are getting a reading intervention. It's not the reading intervention that we got. Let me return now to the study at hand, which is study 3, in which we have a randomized control trial and students are assigned to one of 3 conditions. What did we learn? Well, first, let's look at treatment fidelity. Fidelity refers to the extent to which the treatment aligns with expected practices based on the standardization of the treatment approach. So we would want higher levels of adherence. And so if 4 is perfect adherence across approximately 20 criteria, what we see is that on average within the reading and anxiety program, the reading adherence is 3.62 out of 4, which is quite high. And the anxiety management adherence is 3.51 out of 4, which is also high. So in general, in the ranks treatment, the fidelity suggests that the personnel we hired and trained to deliver the ranks treatment did so in a way in which we would have high fidelity. In terms of reading and math, in terms of the reading adherence, again, 3.59. According to the math adherence, which was largely math fact practice, was 3.86, extremely high. So again, fidelity is high for both the ranks and math condition. Of course, we don't have fidelity scores for the business as usual condition because business as usual condition is a comparison condition in which we have no expected protocol, but we know that various reading comprehension practices were done. So let's take a look at the counterfactual for business as usual. What we do know about the business as usual condition is that about 74%, or almost 3/4, of the business as usual students received a small group intervention from a credentialed teacher. So this means these are students in schools who were assigned to the business as usual condition by us. However, the schools provided them with reading interventions. Sometimes these interventions were provided by the classroom teacher, the reading interventionist, or the special education teacher, and that the group sizes ranged from 1 to 5, and that the students who did not receive a small group intervention were typically asked to work on reading tasks independently or with peers. So what you can see is that the business as usual condition was very similar to the reading and anxiety and the reading and math condition, and that reading was provided to students in small groups. However, the nature of that intervention varied because business as usual was determined by the schools. So let's look at the overlap between instruction provided in all of these conditions. And what you'll see is that for the reading and anxiety and reading and math condition, about 55% of the time was reading text comprehension, very similar amount of time for text comprehension in the business as usual condition. Reading fluency, again, pretty similar. Word reading, pretty similar, and other instruction. So what we know is that the reading instruction across conditions had similar foci. However, no anxiety management instruction was observed during reading and math or business as usual condition. So the anxiety management ranks condition was the only one in which anxiety instruction was integrated into the reading instruction. So now let's take a look at some of our outcome measures. The constructs that we were interested in were word reading, decoding, and reading comprehension. And you can see that the measures we used to tap each of these contrasts were the test of word reading efficiency and sight word efficiency, the Woodcock-Johnson word attack, and then a researcher developed, but if you will, psychometrically robust reading comprehension measure called Mini-RC, and then the Gates-McGinnity reading comprehension subtest. The outcome measures also for anxiety included our reading anxiety scale, which is a self-report scale in which students identify the level of anxiety they feel as a result of reading. The social anxiety measure, which is the multidimensional anxiety scale for children, is a social anxiety measure, the MASC social anxiety. And then we looked at general anxiety, which we measured based on the Beck Youth Inventory, which has 2 anxiety scales. So what did we find? Let's look at the analysis. We modeled the full and partial nesting in the data and pretest scores for each outcome as a covariate. and we performed an intent to treat analysis, which means that all students randomized to condition were included in the analyses. We controlled for family-wise error associated with multiple comparisons, and we went back and looked at each of the research questions. For example, for research question 1, where we were looking at reading outcomes, we had contrasts of reading and anxiety versus business as usual and reading and math versus business as usual. For the second research question, which looked at anxiety outcomes, the contrasts were for reading and anxiety versus reading math and reading anxiety versus BAU. So what we found is that at baseline, so prior to the intervention, after students or participants were randomized condition, there were no statistically significant differences between experimental conditions, that is ranks and R math, on reading or anxiety measures. There were differences on reading and anxiety measures were all within the tolerable limits according to the What Works Clearinghouse recommendation. So now let's look at some of the descriptive data from pre to post test on each of the outcome measures of interest. So let's start with the test of word reading efficiency, which is sight word efficiency, which is the extent to which students read words correctly, a very important and necessary component of reading success. And what you can see is that in the gray line, the business as usual condition, and that's based on standard scores, not raw scores, and that's important to note. And you look at the differences, you have a slight slope in favor of reading math and reading anxiety, both of which focused on word reading in the same way. If you look at the Woodcock-Johnson word attack, again, the slope in favor of reading anxiety and reading math as opposed to the BAU condition for word attack. If you look at the mini RC, which is the reading comprehension measure, again, the reading and anxiety and reading math, a positive slope on raw scores, whereas the business as usual condition, a fairly flat slope. So in terms of the descriptive data on the Gates-McGinnity reading test, which is a reading comprehension measure, there are no discernible differences among those groups. And the Gates-McGinnity is a rather difficult task and one where very few intervention studies have yielded statistically significant differences in randomized controlled trials. So now let's look at the effect sizes because that gives us sort of a measure of impact. If you look at the sight word reading and you contrast the reading and anxiety with business as usual, you see that you have a positive effect size of 0.13, for word attack for the reading and anxiety 0.30, for the reading comprehension of the mini RC 0.39, and for the Gates-McGinnity 0.18. These are all favorable effect sizes that suggest strong promise for the reading intervention, particularly as contrasted with BAU. It's a rigorous contrast, and the reason I say that is because the BAU condition also received a reading intervention. Now let's look at the effect sizes for reading when you contrast reading and anxiety, reading and math, and BAU. And you can see here that the reading and math condition has slight, at least with respect to sight words, word attack, and comprehension, very favorable comparison with ranks. And you would expect that to be true because both ranks and RMath have the same reading program that is being implemented. So the contrast with BAU is very similar. Now let's look at the error correction, the Benjamini-Hochberg error correction, and how that influences statistical significance. And what you see is that word attack and reading comprehension are statistically significantly in favor of the ranks and reading math when compared to the BAU. Now let's take a look at anxiety. And in this case, what you want to do is you want to see a slope in the direction of a negative slope, because what we want to do is reduce anxiety. And what you see here is that on the BYI anxiety scale, that the slope looks like it is at least slightly favoring the BAU condition. And for the mask, you see the favor of reading and math. And for reading and anxiety, you see again that our math looks like it's more favorable. So if you look at anxiety effect sizes, what you see is that at least with respect to ranks in BAU, only the social anxiety is slightly affected in favor of the ranks, and neither overall anxiety or reading anxiety. In fact, reading and anxiety based on self-report measures favors the BAU condition. So if you're in the audience, you're probably wondering, well, now why would that be? You're teaching people to manage anxiety, and yet it doesn't appear to have the kind of effect you would expect. I will address that question after I report further on the reading and anxiety effect sizes. And so here, what you're seeing is that ranks versus our math, again, you're getting favorable effects in the direction of our math. And in terms of effect sizes, only for reading and anxiety are you getting a favorable response with respect to ranks. So let's first talk a little bit about some of the limitations, and then let's talk about the implications, and then we will open up for questions, answers, comments, and some of your thoughts. In terms of limitations, so one of the things I want to say is that although there are benefits to using standardized reading comprehension measures, these measures, these standardized measures, are notably weak in terms of optimally aligning to transfer. So I am not the first person to say this, that these more distal reading comprehension measures may not be the best way for us to look at impact. Secondly, I think it's important to talk about the fact that regardless of the treatment condition, students appeared to show modest gains across reading measures, and that these gains were aligned to the treatment, which we find quite favorable. We think these findings that align with previous studies suggesting that small group reading interventions show positive effects, but they're unlikely to fully address the challenges of grade 3 through 8 struggling readers. I think the important point here is that 30 minutes a day, 4 to 5 times a week, for about 20 weeks is an inadequate way to fully address the level of problems that older readers have and that have accumulated over time. In order to have the kind of impact we think is necessary, we believe that aligning what we think of as tier 1 or what's typically taught in general education with tier 2 will be essential. And in fact, some of our work right now is moving just in that direction. Thirdly, the moderate to large effects on social and general anxiety did not replicate. So the findings that we had for year 1, pilot study 1 and pilot study 2 were not replicated. So the moderate to large effects on social and general anxiety did not replicate. And what are the possible explanations? Because that is the most important question. So findings often fail to replicate. So that's not uncommon. We know that replication is a challenging thing. However, adherence to strong students' toolbox for this particular study was lower than in past studies. And perhaps we need to better understand what is happening in the counterfactual related to social emotional. What changes since the last study? Well, one of the things is that the BYI anxiety scale did not show differences. And so this was true in terms of study 2, as you can see the differences, and study 3, where the differences were less pronounced. So what do we think about this? I mean, we don't know. So everything I'm about to say is really a hypothesis that needs further exploration. One possibility is that in the study, our participants were not all students with significant anxiety difficulties. So although they were all students with significant reading difficulties, it's possible that the subgroup of students that had both reading and anxiety problems would differentially respond to the ranks intervention. And so if you look at some of the future interventions appear to vary as a function of initial anxiety, and that would be the important question. So how does initial anxiety influence response to treatment within these conditions? It may be valuable for us in the future to screen for participants who exhibit both elevated levels of anxiety and reading difficulties. And we are doing that in our next study. So it appears if we are successful at procuring funding, which has so far met all the criteria to have us get funded, we will be able to screen for participants who are elevated both in terms of anxiety and reading difficulties. We think that this next study will be an even more interesting contrast between and examining the effects of reading and anxiety. We're also doing some refinements in our professional development about the Strong Students Toolbox so that the professionals providing the reading and anxiety treatment are better able to do so with higher levels of fidelity. So with that in mind, I just want to say thank you so much for listening to this presentation and joining me. And I really look forward to your questions and comments as we move forward. So thank you again.